That I'm not too sure on that.
It's a little symbolic because people are actually seeing the tent go down, which has always been sort of a visual representation that we can stop here, you can get tested. But I think that we're starting to look at how do we live with COVID on an ongoing basis. And I think the assumption is that there'll be some small amount of COVID, even at the best, as it's best controlled. So how do we become more permanent operations? And so no longer in tents, but in permanent structures. Let's have better workflows. Let's make sure that the community, when they need us for testing or for symptoms or exposure, that we're still there. But we got to do it in a more permanent way.
We couldn't put up a permanent structure to appropriately take care of the patients, and we knew there was going to be a surge. So that fact that we utilized our disaster plan, and that's why these tents came up. We saw greater than 1,000 patients over the 7-week period. And it was a tremendous effort to see all of them, definitely. To follow CDC guidelines to prevent further spread of this highly communicable disease to patients inside the hospital.
Right.
So CDC made it very clear that the fundamental goal of testing patients in a hospital setting should be done as much as possible in an outside or separate environment that allowed for, one, good ventilation, as well as physical distancing with minimum 6 feet. In the current configuration of the emergency department, that would have been very challenging. So the decision was made to, although we do have some physical space, it was likely not able to accommodate the expected volume. And that's why the tents were erected for that purpose.